It's important when seeking care for a complex issue like abnormal uterine bleeding that you feel comfortable and confident in the provider that is evaluating this problem and counseling you. When it comes to abnormal bleeding in particular, the sources of your bleeding can be incredibly varied. So you want to make sure that someone is being thorough, spending a lot of time listening to you, thinking about what all of your possible sources for bleeding may be, as well as what all the different options for treatment may be. This is not cookbook medicine. There's not a one-size-fits-all treatment for something like abnormal uterine bleeding. Whenever I discuss with someone what their treatment options are, I'm going to always go over every single option, including what are the risks, the benefits, the alternatives, the side effects of any possible medications, and then encourage them to go home and think about it and research it a little bit before making a decision. I want to be sure that whatever decision that you make about your treatment, you feel very comfortable and confident that you have a lot of information so that if you don't get the outcome you're looking for, you knew that that was a possibility.
I've been a gynecologist for a long time, and I've been involved with the care of women for almost 30 years. I have a few lessons that I've learned over that time, and I think that they're good guides for anybody who's providing care. The first thing is that I think it's really important to listen to people and give them a time to say what's on their minds. That means that I have to be in the moment with the patient. I have to be able to devote my full attention to them. Secondly, I think it's important to realize that it's not my body, it's yours. And so while I try and be full and complete in my explanations and offering various options, ultimately the final decision about treatment options and how to take care of a particular problem is one that I fully involve patients in, because I think that it's up to you to make the right decision for your own body.
When it comes to treating abnormal uterine bleeding, it's all about improving your quality of life. Different patients are going to have different goals. For some patients, they may want no bleeding at all. For some patients, they just want an improvement in their bleeding. Either way, we're likely to have lots of choices, various options to help you achieve those goals. When I discuss treatment options with patients, I always like to think sequentially from most conservative to least conservative options. Most conservative options may be observation, iron treatment if you're a little anemic. Next would be medical treatment, such as hormonal medications or contraceptive pills. Then we start thinking more minimally invasive surgeries, maybe something like a DNC or endometrial ablation. And lastly, our least conservative but most definitive surgical option for abnormal bleeding typically is hysterectomy.
I actually love this hospital. I've been to a few different hospitals. In this hospital, I take my kids here. I switched everything over to where we could have the doctors and nurses from here because at the other hospitals, I've actually, one of the reasons I almost died from having my son was because of the hospital. And so the doctors and nurses here are wonderful.
Abnormal uterine bleeding is a very common gynecologic condition which really impacts women's quality of life on a regular basis. If you're having this problem, we are very experienced gynecologists and have a lot of expertise in helping deal with this problem.
We understand that this is a very important as well as a highly personal topic, and we take your confidence in North Suburban to heart. North Suburban is a leading hospital in North Denver, and we are committed, above all else, to the care and improvement of human life. North Suburban recently received the Women's Choice Award as being one of the top hospitals in the nation in patient safety. Additionally, North Suburban received recognition from the Joint Commission as a top performer in key quality indicators, one of just 2 hospitals in the entire state of Colorado to receive this recognition. I can assure you that these quality distinctions extend throughout all areas of the medical center and most certainly within our women's services departments.
Here at Women's Health Group and North Suburban Medical Center, we have many providers who have a wealth of experience in managing this complex problem. We're here to help and we look forward to working with you so that you can achieve those goals that are most important to you individually.
We're happy to answer any questions and help you make the best treatment decisions for your own particular situation.